everyone, and good afternoon. My name is Jackie Lizer. I'm a senior manager here at CAQH. And I'm really excited to welcome you all to our 2024 CAQH Index Report webinar. As you may know, we just published our 11th annual CAQH Index Report, and today we have esteemed panelists who are joining us today to talk a bit about how the index tracks transactions and electronic adoption and how that helps us build better care through healthcare automation. Before I go ahead and turn it over to our team and our guests for today, I'm just going to run through some quick webinar logistics for Zoom. In today's session, we will be recording and we'll also be saving a copy of the slide deck afterwards. So anyone who has registered or attended for the webinar, you'll receive a link to the recording afterwards in an email in 1 to 2 business days. All audience members will have their microphones muted during the webinar. However, we do encourage questions throughout the presentation. If you have a question for any of our staff or panelists, please feel free to submit them using that Q&A feature at the bottom of your screen. And at the end of the presentation, we will have a few minutes to go through those questions and ask some of them live. With that, I'm going to go ahead and turn it over to Erin Weber, our Chief Policy and Research Officer, to run through our agenda for the day and give a brief overview of the index report.
Great, thanks, Jackie. Thanks, Jackie, and thanks everyone for joining us today. We are really excited to have just released the 2024 CAQH Index Report. This is our 12th annual report where we have been tracking this information. And if you haven't had a chance to get into the details of the report, I would encourage you, I think they're going to put a link to the report in the chat. I would encourage you to go out there, download the report, and get all of the details. Traditionally, we've done a webinar where we go through the findings of the report, but this year we thought we'd do something a little bit different and invite some of our friends from around the industry to join us in a conversation around what the findings from the index report mean for the healthcare system, for providers, for health plans, for the dental industry, and most importantly, for patients. So I'm going to give you a quick overview of the report itself, if we want to move on to the next slide, and then I'm going to turn it over to Christine Bernaska, our Senior Director of Research and Measurement at CAQH, and she's really the genius behind the report, and she's going to lead the discussion with our panelists today. As I mentioned, this is our 12th annual report, so we have a lot of trended data on the industry's progress towards automating key transactions in the administrative workflow. So from the time a patient encounter is scheduled all the way through when the provider is paid for that encounter, that information exchange between providers and health plans is occurring using either electronic transactions, maybe a portal, or sometimes it's a manual process where the provider or the plan is picking up the phone and calling the other organization to get the information they need to process the transaction. Each of those processes has different costs and time requirements of staff associated with it. And so what the report does is really identify how automation is driving time and cost savings across the industry and tracks our progress towards that. The report is guided by the CAQH Index Council, representatives from across the industry who help us develop the questions, vet the findings, and create this resource for the industry. This year's index report represented data from health plans representing about 63% of covered lives and about 600 plus provider organizations. So it is quite an undertaking, and we are very grateful to our industry partners who are submitting data and our association partners who are out there encouraging their members to participate in the index report. It's only as good as the data we receive, and so your all's continued engagement helps make this report what it is today. On slide 5, I just want to highlight some of the key findings from this year's report. We have seen this report now over 12 years. And while progress has been made, there is still significant opportunity. Of the 8 tasks that we measure in the report, the total industry spend for every single transaction conducted in a year was $90 billion. That's a lot of money. We believe, though, that of that $90 billion, the industry can save an additional $20 billion annually by automating all of the transactions being conducted. Overall, about $222 billion has been saved annually by the industry through automation. So we've made a lot of progress. We just have a little bit more to go, and it's significant. One of the things we dug into this year was how do those cost savings accrue to the health plan and the provider? And you can see on this bar chart here, that light blue color is the accrual to the provider. So a lot of opportunity for provider savings. And that cost savings opportunity is largely driven by the volume of the transactions. Eligibility is by far our highest volume transaction at 31 billion eligibility transactions per year. If you think about the cost savings associated with that, even though eligibility is automated 94% of the time, I believe, in the medical industry, that last 6% accounts for about 12 billion of that 20 billion savings opportunity. So it's really important to think about how we influence these costs over time. On the next slide, this is our trended data by transaction for both the medical and the dental industry. For several years now, the index has also collected data from dental plans and providers to see the progress that that particular part of the industry has made. I'll first highlight some of the lows here. Prior authorization, we've seen a steady rise over time related to prior authorization. However, it's still only at 35%. The good news is that there are new requirements coming out of CMS to transition this particular transaction to use FHIR APIs, a different way to exchange data. And there's a lot of hope around some implementation dates in January 1, 2027 that will really help drive greater automation of prior authorization. And I suspect our panelists will touch on this today. The other area we've seen some progress is around, another low area is around payment and remittance on the dental side. And I'm sure Rebecca's going to have some thoughts on this. But that industry is still lagging in terms of automating the back end processes of the healthcare revenue cycle. I think some of the highlights are eligibility. I mentioned that medical plans, I guess, are at 96% today, and dental plans are at 82%. And you've seen they've made steady progress over time. Given the high volume of that transaction, every percentage point that is increased and done in an automated fashion results in significant industry savings. And the other high I want to highlight is the remittance advice on the medical side. Over the last 5 years, we've gone from 57% electronic to 89% electronic. So we're saving a lot of time and costs across the industry through the automation of that transaction over the last 5 years. So now I'm going to turn it over to Christine to introduce our panel. And I just want to thank you all again for joining us and really encourage you to take a deep look at the report to get more information. Thanks.
Great. Thanks, Erin. Again, just emphasize to everyone that we thank all those who participated in the index and always look forward to looking at the index and the trends. This is my 6th year conducting the index. And every year it's interesting to me to see what's going on, how the trends are being impacted. And what I enjoy most of all is digging deeper into those trends. What is driving that from a data perspective and also contextually what's going on in the industry. Erin touched on some of the rules and regulations. We also see different things going on from a socioeconomic standpoint, as well as just industry overall. COVID hit hard. We have changes in technology. We have AI. So every year things are a little bit different, and I'm always excited to see what the next year will bring. I'm very excited to be here today with our great group of panelists. We have a very diverse group. We have panelists representing the patient side, the plan side, regulatory side, dental side. And what we're going to talk to them about today, as Erin had touched on, savings opportunities, as well as challenges and best practices all around automation. And hopefully we're going to close with some thoughts around what the industry can do together to close this automation gap. Erin talked and mentioned that we still have this $20 billion savings opportunity. Well, what can we do as an industry overall to help start closing that gap? Knowing that that number hasn't changed a whole lot over time. So really want to talk to some of these experts in the field to get a sense as to what they hear from their stakeholders. What do they know is important to them, and what are some of the challenges, as well as some of the best practices? So without further ado, I'm going to turn it over to our panelists to introduce themselves, and also really curious to hear from them, what do they think is important in the index, and what do they use it for? We write this report every year. We're always curious to know what are the highlights that industry takes away from the index. And also, as we continue to improve and enhance the value of the index and the importance that we share with the industry related to the findings, curious to see what others use it for. We know what we use it for. We know how near and dear it is to us, but always interested to hear from stakeholders and folks like yourself how you use it. So, Laura, I'm going to start with you. Very happy to have you on the call. So would you like to introduce yourself and just tell us a little bit about what you find important in the index and how you've used it?
Yeah, thanks, Christine. So I'm Laura Cooley. I am the editor-in-chief of the Journal of Patient Experience. And when we talk about patient experience, for me, it's really a holistic view of the many touch points, sort of like the slide we saw earlier. And in those touch points, people experience their access to care, how they're managing their health. It's not all about satisfaction. It's really, to me, about reducing suffering and supporting what matters most to our patients, our families, our plan members, and consumers at large. And our workforce is a huge part of that. And so to me, I was really excited to see throughout the index report call outs about how we're impacting patients by looking at these findings, and how ideally we can reduce administrative inefficiencies and help our healthcare providers and staff reinvest their resources to reduce suffering for the patients that we're serving in health and care experience.
Yeah, no, Laura, just to point out that patient impact section was something new that we focused on this year. CAQH overall is has been looking at the patient impact, keeping patient at the center of everything that we're looking at. And so new section that we added, and feel very strongly about that. And obviously, it's to your point that understanding that everything that we do in this administrative burden greatly impacts the patient and the care that they receive. Sophia, would you like to introduce yourself?
Hi, everyone. My name is Sophia Fayazdeen. I'm from United Healthcare, and I'm a product director for Provider Digital Products, and I'm representing the EDI and API products. So as a payer, participating in the CAQH core index helps me understand the adoption rate of each transaction. So it really helps me understand, okay, so where are we with the adoption of each transactions, like as Christine called out, where are we with the 278 adoption or 270, so that's really helps me look at that, and benchmarking it helps us to identify, okay, where we need to focus, so we can set the goals to improve any enhancements or enrichments that we can do to improve the automation. And also, I'm excited about the opportunity for collaborating with the industry stakeholders by participating in the CAQH index, because it by doing that, by sharing our experience as a payer and learning from one another, from other industry stakeholders, it helps us to see where we could make improvements as a payer, so that can improve us, help us towards, increasing the adoption of automation and creating more efficient and effective healthcare system.
Great. Thanks, Sophia. And just for those of you, Sophia mentioned the benchmark report for all providers and payers who participate in the index. Everyone receives a benchmark report at the end, which allows your organization to compare your results to industry aggregate results. And so I think, Sophia, that's what you were referring to when you were talking about some of the benchmarking estimates. Rebecca, would you like to introduce yourself?
Sure. Hello, everyone. Rebecca Fien. I'm the Director for Dental Benefits Coding and Data Exchange at the American Dental Association. Such a privilege to join the panel and really express my appreciation for CAQH. The index really, by breaking out dental, helps us understand what's going on in the dental industry, and then use that information to communicate it both to ourselves often, but then to others in the industry about the needs. Often dental providers are kind of lumped in as a separate group, but we have different business sort of workflows and practices and use data differently. And so having it broken out is really essential as we talk about issue prioritization, how we use the data in policy and advocacy. We speak a lot to sort of regulators and in federal policy making about sort of what are the considerations that dental providers might need other than the broader healthcare world. And then when we're talking about things like, Christine, you brought up ERA, the low adoption of ERA, and talking about the benefit, giving real numbers, giving solid evidence to our providers and to our technology partners really helps in those conversations.
Great. Thanks, Rebecca. And last but not least, Rob, would you like to introduce yourself?
Yeah, thank you. Rob Tennant, Executive Director of the Work Group for Electronic Data Interchange, better known as WEDI. We're a multi-stakeholder group, so we represent health plans, providers, vendors, clearinghouses, all of the standards development organizations, and CAQH core. And I will say, I'll start by saying thank you, because I've been involved with the index since it began a lot of years ago. And I can tell you that, you guys see the report, but what you don't see is the incredible amount of work behind the scenes. Aaron, Christine, you guys do a phenomenal job of collecting and analyzing this data. There really is nothing like it in the industry. And as Rebecca said, and Sophia, if you can't measure something, you can't improve it. And I think it's critical, even though we see that some of the transactions are close to, if not at 100% use, a lot of them are not. We need to understand where the gaps are, and then as an industry, take steps to close those gaps. I'll say as well that we work at WEDI very closely with CMS, in particular the National Standards Group that oversees the EDI transactions, and they are leveraged significantly by the federal government, because they need to know how the industry is doing before they mandate new standards, for example. So as important as the index has been in the past, I think it's even more important going forward as the industry begins to transition to new types of standards like the APIs in the recent CMS rule.
Yeah, no, thank you, Rob. And thank you for your devotion to the index over many, many, many years. We appreciate it. Well, thanks everyone for the introduction. It's great to hear how you use index as well as how you represent the various stakeholder groups that we'll touch on. We now have an audience poll that we're going to jump to. As I mentioned, each year we look to improve the index and are always looking to provide more value to industry. And so just as I asked the panelists how they use index, we'd just like to get a pulse from all of you in the audience is, how do you plan to use the 2024 index and data findings? And as you'll see on the screen here, there are some choices. So policy research, academic research, business case development, ROI analysis, workflow implementation, government and regulatory compliance, marketing, PR, or other. So I'll give you all about 10 seconds to respond. And while we won't display the results, we will be looking at these results after the call. And as I said, as we gear up for the 2025 index, we will then take all these responses into account, because as I had indicated, we do look at these results and are always trying to improve and enhance the report. Give you all another 2 or 3 seconds. Okay, I think we can close the poll, and thanks everyone for responding. As I said, appreciate hearing from all the stakeholders and for all of those who use the report. It's very helpful for us. So turning back now to the panel discussion, we talked about, and I mentioned it as well as Aaron, this big savings opportunity. So curious to hear from the panelists, if you could achieve this savings opportunity, how would it impact the organizations that you represent or the stakeholder groups? So I'm going to start with you, Rebecca, representing the dental industry. So in the, rose-colored world, we achieved this savings 20 billion. How would that impact the dental industry, the providers and plans?
Sure. I think one of the things that I have to call out about the dental industry that's really important is that we're still a cottage industry. Just things are changing. You're seeing more large group practices and things like that. But we're talking often about small practices with 1 or 2 doctors with staff of, 4 or 5. I mean, even smaller than that in some cases. So we're looking for ways that can maximize results with the lowest level of effort. And automation is the way to get there, especially as we think about, all of the complexity that goes into revenue cycle management and those HIPAA mandated transactions. Automation is the solution. Prior to automation, it was sort of the Wild West out there, everybody doing things differently, everybody had different solutions. And by pursuing automation, we can streamline that and take that burden off. Dentists are really facing some real big challenges right now, staffing issues. A lot of our staffing didn't recover after COVID. Dental benefits are always kind of the first on the line when there are cuts, whether those are commercial cuts from employer groups or public program cuts. So finding efficiencies where dentists can do the best they can to meet the needs of their patients while still being able to operate as a business is really important. And then further, it's just that relationship between the provider and the patient. When someone comes into the office and you're presented with this sort of, well, we don't know what you're eligible for, or let me call, or their benefits have changed. Hey, you know what? We can't get this information. Maybe we need to reschedule this, or we can't tell you what your treatment plan is actually going to cost. That impacts that relationship. The patient gets concerned. So I don't want to jump too far into what Laura might talk about, but that's a real thing. The dentists are kind of on the front line in a different way. So automation and the savings, it's just so important to our industry.
Yeah, it sounds like it could make a huge difference, particularly for those mom and pop shops. When we talk to the dental industry and we talk to those providers when we do the index, and we hear a lot of those issues and concerns. Rob, I know for you work on the regulatory side and also represent providers. Curious to hear your thoughts on this. Putting on your hats for both providers and kind of the regulatory industry, what would you say would be the biggest impact?
Yeah, no, I think I would echo what Rebecca said, and I would key on the word abrasion. There's a lot of abrasion now between providers and health plans that is really driven through this administrative waste and the idea that there are multiple ways to achieve one transaction. I think what we're seeing with increased automation is the ability in particular to reduce the number of phone calls, which benefits both health plans and providers. getting away perhaps from the proprietary web portal approach, which makes sense for the health plan, but for, in particular, a large provider, they may have contracts with dozens of different health plans requiring each proprietary web portal to be supported. So I think if we can reduce that abrasion, not only are you going to reduce cost, but you're going to reduce what we're seeing now is an increased level of burnout among clinicians. So when you, in particular on the prior auth side, but it also applies across the board, when you automate, you simplify, and that is going to benefit everybody. And I have to say, in today's environment, there's not a lot of extra money lying around for administrative waste. And so I think it's an opportunity for the industry to really take on the task of identifying these areas of waste and reducing them.
Oh, great. It's echoing and making a lot of sense again from when we do talk to the plans and the providers. Laura, I want to follow up with you and they talk about abrasion, and from your perspective, the patient side, I would suspect that you have some thoughts about that and how the abrasion, the burden, how it's impacting plans and providers and how that trickles down to the patient side.
Yeah, I think Rob used important words: reducing abrasion, mitigating burnout, and may not go away for our clinicians and staff as kind of pathways to enhancing patient experience. And as named, finances are tight across the industry. And so we have to find ways to strengthen relationships, as Rebecca said. And, ideally we're reducing administrative inefficiencies so that we can reinvest those resources in what really matters, which is improving the health and care experiences of the people that we're serving. And some of that reinvesting might, if we're thinking about what would we do with this $20 billion in savings, like I hope we could reinvest some of it in our patients. And that might be expanding access to services, enhancing the coordination of their care, investing in development of our staff and our clinicians so that empathy and communication skills and kind of the fundamentals of humanism can really bubble up in a bigger way that we maybe don't feel like we have the capacities for now. And, ideally, again, if we improve our administrative processes, our patients will see fewer delays, they'll have less confusion, and they'll have less stress in those healthcare interactions.
Yes. Sophia, we've talked about providers. We've heard about the patient side and Rebecca touched a bit on the plan side, but wanted to hear more from you on the plan perspective. Achieve this as savings. How would this impact plans?
Sure.
From your perspective?
Yeah, for us, from a payer plan perspective, the automation helps us largely in reducing the operation cost, not just for us, also for the providers. In both sides, we would see reduced operational cost, as well as it will reduce the provider operations, as Bob called out, and it improves the efficiency. And the one thing I want to call out is that we want all our providers to have a consistent experience. Having it automated and have that same consistent experience given to all of our providers, it will reduce automatically the operation cost by reducing our call volumes and whatnot. So currently we do see a large call volumes for the eligibility and benefit related transactions. And I believe so. That kind of prompts us to think about, okay, what is it that we don't have it automated or available through the transactions that we are sharing, and what we could do, that to improve that. And I do see the upcoming operational rule from CAQH on the EDI 270 to 71 can largely help with reducing the those calls and questions that we are getting on the eligibilities and benefits. So similarly, I think that having more standardizations and more rules around things that where we are not having that available through those transactions. And if we can make it available, that will automate things for both providers and payers. And as a result, we can have that, what we want, that consistent experience for our providers.
Yeah, no, that's really helpful. And all this discussion trickles into the next question that I was going to ask of all of you was around the challenges of automating processes. And you all touched on it a little bit. I mean, Sophia, you touched on it quite a bit when you were talking about, and if I heard you correctly, kind of the lack of standardization and different processes. And we talked about the need for automation. Are there any other, specific challenges that you can share in looking at all the panelists? I know, Rebecca, you had indicated, obviously, smaller mom and pop shops, and it may be more resource specific, right? They may not have the financial means or the technological skills. But is there anything specific that you want to call out, Laura and Rob as well, that are challenges that you see that your stakeholders or your organizations are really struggling with? So yeah, I don't know if you want to.
Yeah, I can go.
I see Rebecca nodding her head as
yeah.
well.
I can go first on this one. So the interoperability challenges is the main thing that I see. When we work with our providers, they may have different ways of, connecting to the payers, and having that one standard format available, and it's, more flexible for the healthcare systems and the stakeholders' needs, will reduce that, the part of them, both payer and provider, not having a standard formats, right? So again, as Bob called out at the beginning, having the CMS rules are coming around the prior authorizations, or even in general coming with that FHIR models, definitely is going to help us to achieve that interoperability challenges that we are currently seeing as we work with our providers. So that's something that I definitely have that as a challenge that I wanted to call out.
Interoperability. Rebecca, I see you smiling and nodding. Do you have anything you'd like to add?
Sure. So I think I'd like to level set a little bit in that, and I'm going to make generalizations because, and I don't mean to offend anybody on the medical side, but on the dental side, we just do things differently. And so the current version of the HIPAA mandated transactions are not sufficient for our business needs. I think most of the industry would agree with me on that. So when we talk about standardization, we have to talk about the regulatory environment. We have to advance the HIPAA mandated transactions so that when we do come across automation, those automations deliver the information that we need. They're not right now. The lack of delivering that data means that we have to default to direct data entry, which is those portals. And just one segment, just for Medicare Advantage plans that have a supplemental dental benefit, there's 43 plans per consumer. So at any given time, a single practice provider may have hundreds of variations coming in, going to portals, trying to figure out what's covered, what's not covered. The least networks is an issue, right? Am I in network or am I not in network? And this is all information that right now we can't deliver in an automated, standardized way. Certainly there's emerging technologies, emerging products on the market, but again, we don't have tech stacks. We don't have IT developers and IT folks managing the software in our offices, and it's prohibitively costly for our providers. And it's really something that's a basic business function that the whole industry should be able to deliver on at a push of a button. And we're held back because of the lack of advancement in sort of the standards. And I think you can see from the CAQH data going back, just eligibility and benefits, a return of, yes, this person is eligible it's not enough, right? We need to know frequency limitations. We need to know exclusions. We need to know that information. Otherwise, we're not going to have successful trading relationships with everyone in the industry.
No, thank you for sharing that, Rebecca. Thank you. Rob, I also see you nodding.
Yeah, boy, I think Rebecca hit it on the head. Let me talk a little bit more about the regulatory side because it's an interesting case study, in particular the 278 transaction, which, if you look at the index, you can see it's slightly ticking up year by year, but it's only at about 35%. And I think that was one of the reasons, frankly, why CMS decided to come out with the 0057 rule, seeing that use of the 278 was so low. Of course, the reality is the reason, or one of the reasons why the utilization of the transaction is so low is because CMS failed to release a final rule for the attachment standard, because prior auth in particular is a different type of transaction from the others. It's what we call a conversation more than a transaction. It's a back and forth between the provider and the health plan. The health plan needs a lot of clinical data in many cases in order to make the decision, but there's no standard way of moving that data to the health plan. So the fact that CMS, even though it was mandated twice by Congress to issue a rule for attachments, failed to do so, and still we're waiting for the rule. So I think that could be one of the drivers. And I think a lot of us are looking at the future saying it's more likely than not that we'll have a hybrid situation going forward where some percentage will use APIs, some percentage will use 278s, and some will continue to use portals. But we have to have the standards in place. And as Rebecca said, it's been 12, 13 years since we had the last X12 version of these standards. Every year, X12 updates them, they improve them, but CMS has not mandated these new updates. And in fact, I don't want to speak for X12, but we have heard that they are working very hard on the latest version, which we hope will be adopted by CMS. If I can say one more thing, the other improvement area is what I will call trust. You mentioned the incredibly high volume of eligibility transactions. In fact, more eligibility transactions than even claims. And the reason for that, at least in part, is sort of the belt and suspenders approach that some providers use. So they'll check eligibility a month out, a week out, a day out, the day of, the afternoon of, just to make sure that they get the same information from the health plan. So I think building that trust between payers and providers will help that. And it will help the other relatively low number, which is the automated payment from the health plan to the provider. I think some providers are under the assumption that if they give the bank account number to the health plan can come in and take money out. Of course, they can't, but it's that fear, that trust, that if there's more education, building more trust, I think the use of things like the ACH direct deposit approach will increase.
So thank you for talking about trust, Rob. I'll jump in and speak about trust from a slightly different angle, and that is how do we establish or reinvest in the trust with our patients? And we know we have trust challenges in our healthcare system today. We saw a lot of disruption at the end of last year as we heard terrible stories about claims denials and patient frustrations with how they are or are not being funded for the care they thought they could get. And I think there's also a distrust of technology for some patients, and this idea that there could be a loss of human connection if things are very automated, whether that's from a billing perspective or a claims perspective or some other element. And I think we just have to hold these tensions and continue to recognize what the challenges are going to be from the human patient perspective on this. I think there's a worry for patients that their real needs aren't seen, and they're not seen as a person. They're seen as some kind of file, and it goes through automation, and there's AI, and they're not really being cared for. They're being looked at as numbers or data, and that data may or may not feel accurate, and there could be equity issues. So I think there are lots of challenges for us to address as we continue to do this, and we must, because automation is critical.
Yeah, thanks, Laura, for bringing in the trust of the patients. I had that, I wrote that down, that I was going to mention that and ask you about that as well. So we talked about a lot of challenges, and there's a lot of, that sounds a little bit bleak, and we have this gap. Wanted to hear from all of you quickly, as I mentioned, challenges, there's a lot of opportunities. What are some best practices? What have you heard, or what have you done from an organizational standpoint that have worked, that even if they were small things, that have really helped closing that gap? As you saw on the slide that Aaron presented, we are making strides. The medical and dental industry, electronic adoption is going up. So clearly things are working. The industry is pushing. We're moving forward, despite the fact that we still have that $20 billion savings opportunity. So what have you heard or experienced or even implemented that has been working? I think it would be helpful for those in the industry and those on the call to hear that. I don't know, Laura, you're on the call right now. I don't know if you're up right now. I don't know if there's anything you'd like to add.
I think my colleagues might have more direct things to offer. However, the things that I had thought about in preparing for this conversation are best practices that can leverage automation while protecting the patient experience. And I think prioritizing transparency with our communication is a top category. How can we proactively explain how automated processes are working for our patients, particularly around billing, which is a huge concern and sometimes a life destroyer. Prior authorizations, medical record access, this can really reduce anxiety and build trust if we can be more transparent and explain things in a way people can understand when we are in actual conversations. So I'll stop there and pass the baton. Why don't I pass the baton to Sophia? I'm sure she has something to speak to.
Sure.
Great. Thanks, Laura.
So as we all know how fast changing the healthcare industry is. So we constantly, as a best practice, we constantly look into several metrics to continuously improve the transactions and the digital transactions that we have. Improvements and enhancements we have to continue to make. As we have plans that may have so many breakdowns now, which was not the case before. So that's where we continuously make changes and enhancements to our transactions to keep up with the fast changing the healthcare industry is. So that's one of it. The other one I would call out is as another best practice, we within as a payer, within our systems, we want to have some standardizations to the process and the data formats that we would be sharing. To keep the consistency across the systems, what we have and how we are talking externally to our providers should be the same language, right? So those are the sort of the best practices we are doing to keep up with our automation and improve the efficiency for our providers.
Yeah, that's great.
Yeah, I'll just pick up on that thread. I think there's a few things we should be looking at. One is education. These are complex business processes, and encouraging health plans and providers to work together to solve problems, to come up with standardized solutions by letting providers know that there is real advantage for moving to these automated transactions, even showing some numbers based on the index report. So it's an independent review of the numbers. I think that will go a long way, especially for smaller providers that, aren't, as willing perhaps to invest in the technology if they don't know there's going to be a clear return on investment. I'm thinking of the dental practices in particular. But I think the other area is simply to get involved. Get involved in CAQH Core, get involved in the standards groups, get involved at the grassroots. So you're building these transactions to be better. And as they improve, use will increase. And that applies, I think, to sort of the new wave coming forward with APIs. And then the final thing is to not look at these transactions in a silo, because I think one thing we can all agree on is better information in the hands of clinicians will improve care and decrease costs. And so if you think about providers using the eligibility transaction, remittance, being able to get information to and from the health plan to improve care, that's really going to drive improvements as well.
I'm gonna take a little moment of privilege and say, we have in the dental industry, the prior auth thing figured out because we use predetermination, and we don't have to worry about some of the challenges that our medical colleagues have with prior authorization. So I think my little jab there, but all in friendly joking, I think for us, it's about the relationship. We have so many calls coming into the ADA. I can't get a hold of this insurer. I'm in network, but they never answer their phones. I've sent in letters and we never get any communication back. And that's where my team kind of steps in and say, okay, we have this contact, and we have to sometimes route it through multiple divisions at an individual group just to try to get an answer. And I know some of it is the provider doesn't have the right information, or they're calling the wrong line or something like that. But it's really about that transparency. Who are the right people to connect with when there is an issue, so that we don't have something that goes on for 6 weeks and the provider's been away, from the chair for 3-4 hours trying to resolve one claim issue. So it's really about making sure that we're building those relationships and it doesn't turn into an adversarial process. I think that's huge. And then the other piece is I have to call out our industry. We meet on a regular basis and say, hey, this is working, this isn't working. And we're proactively engaged at X12, at CAQH, at HL7, saying, if we're going to make this better, what does better look like? And we definitely need more voices to come to the table at those organizations.
Right. We have about 12 minutes left. So before we get to some audience questions, I just wanted to ask a closing question. So I'll thank all of you. I think there's a lot of information that we shared and talked about related to challenges, some best practices, and what can be done to help achieve this closure of this gap that we're seeing, knowing that despite the fact that we had a large savings opportunity, progress is being made. I mean, we are improving. We see the adoption is going up, but we still have a way to go. And eligibility and benefit, as Aaron pointed out, while we're at 96% adoption, that 4% or 94%, that small percentage that we still have to go is very, very costly to the industry, and what can we do to bridge that, to get there, to get closer to 100%, or even just slowly inch up, whether it's 98%, that will really reduce the overall administrative burden to the industry. So I'm going to ask each of you, from where you sit, kind of as a summary to all of this, in the short term, what do you think the industry can do to help close this gap? I know we talked about each of your various perspectives from a stakeholder viewpoint, right? From the dental, from the medical plans providers, but just thinking about the industry overall and whether it may be a policy change or regulatory change, or just you had one thing that you would say could be done in the short term. what would that be that you think would have the greatest impact? And so, Rebecca, you're smiling, so I'm going to say, I feel like maybe you have an answer to that. So I'm going to kick it over to you first.
I'm going to, I mean, it's updating the standards that we use for automation. I don't want us to see an era where we're relying on proprietary solutions to get essential business functions. And I think we can get there if everybody sort of is advocating for the same thing. Let's actually do what administrative simplification was meant to do, which was simplify the process so that we can focus on all of the more important things like actual care delivery.
Yeah, and I'll just jump in and say, you know, CAQH is already doing a nice job of keeping the patient in the conversation. So thank you for inviting me. You know, I think if we can continue to step back as we work on regulations or other policy changes or standardization and say, okay, hold on, and like, where is the member experience, member engagement, patient experience, patient engagement in this conversation, then I think we can really move forward in a more intentional way.
Great.
And I'll just add that the standards that we use, whether it be eligibility or claim, which are two very automated transactions, they're not entirely standardized. I think that's one of the challenges. And to Rebecca's point, the standard is now 12 plus years old. There's a lot of variation. So health plans, because of the nature of the standards, are allowed to produce slight variations on the standard, which then requires providers to submit the transaction through an intermediary. So there's even more potential savings should the standards be further standardized and the direct connections between providers and plans can take place. And it applies on the plan side. A lot of plans have clearinghouses simply to convert different standards of one standard into the format that they can absorb. So I think there's a lot of work to be done, even with the standards that we use at a high rate. So I think education, and as Rebecca said, we have to work together as an industry. We can't be in our silos working independently. We need to work together to solve the problems.
And I will go, and from my standpoint, from a payer standpoint, as Bob mentioned, a few minutes ago when we talked about the challenges, we are working closely with our providers to understand what is it that we could do to help them with the automation. So that, we are more in the situation of the hybrid model, what Bob, you mentioned, like, those who are, good with going through the EDI route, or, API or portal, what is their need and what fits best for their practices. And that's the solution that we are offering to make sure, as a short term, we will continue to keep up with the automation. But as a long term, as we are coming up with the standardization and the interoperability, I believe that would help us to, more switch to that one standard model that would help all the providers. But I also want to call out that I don't know the answer to it, but want to make sure that I kind of share. We do have different sizes of providers we deal with, right? Some are very smaller group who may not be investing a ton of, money in doing some automations in a big approach. So these standardizations and the new regulations or whatnot that we are coming up with, and I'm hoping those are more something that we could easily make it adaptable for the providers, regardless of what size of providers they are, and how easily it is adaptable is something that I want us to consider as we are looking to the new regulations and new standard formats that we are coming up with.
Right. That was it. I was going to turn it over to Jackie to see if we had any questions. I know we don't have a lot of time left. So Jackie, I don't know if there's a question or that we could probably answer quickly, or if we want to just wrap up.
Sure, yeah, we have some questions about how to get involved. And so maybe it is a good time to just put up our next slide and I can cover that. And then as the audience, if you think of more questions, I know we are a little bit short on time. Feel free to also just send us an email or, you can drop them in the chat and we can get back to you afterwards as well. But if you want to go to the next slide, Sarah, I can go over how to get involved and where to find us and ask those questions. Sarah, could you just go to the next slide? Not sure there might be. Oh, here we go. Perfect. So yeah, thank you all so much for joining us today. And hopefully this answers a few of those questions that I saw floating in the chat. But I did put a link in the beginning on where to download the index. So if you're having trouble finding it and you scroll up to that chat, you can click the link to download and you can read the full report there. It has a lot of great information and kind of touches on a lot of the valuable insights that our panelists have given us today. As I mentioned, we'll also send out these slides afterwards, and the link is going to be included in the deck, and someone's asking about the recording as well. We will also be posting the recording to our website and send you the link on where to find that. The next action item that some folks are asking about is how do we get involved in the index this year? And so if you are interested in being a part of contributing data to the index, the collection begins in the summer. So if you'd like to register, you can use the link when we send out the slides to register and get information about how to participate and keep an eye out for those emails from our team. And then lastly, just exploring industry research. So you can view all of our reports on our website. There's another handy link on this slide just to get a deeper understanding of where industry is in terms of opportunities, process automation, and much more. Our email for insights is at the bottom of the screen. It's insights@caqh.org. Someone also sent a question about how to get involved with CORE, because I think Rob and Christine might have touched on that briefly. If you're interested in CAQH CORE, that email is core@caqh.org. But no matter which email you send us to, we will make sure to get you to the right place. Thank you all so much. Thank you to our lovely panelists. It was so great to get your insights from varying perspectives. It was a wonderful conversation. And with that, I think we are all set to wrap up for today. So thanks everyone for joining and have a wonderful rest of your afternoon.
Thanks, Jackie.